Hello, my name is Dr.Fraum, and I'm an assistant professor of radiology with appointments in abdominal imaging and nuclear medicine at the Washington University School of Medicine in St. Louis, Missouri. I specialize in oncologic imaging with a focus on MRI and PET studies. Today, I'll be addressing the question of what is an image-guided biopsy and what are its risks and benefits. A biopsy is the process of taking a small sample of tissue for analysis. In the setting of cancer, we are often talking about taking samples of tissues that are known or suspected to be cancerous. The tissue sample may then be sent to a pathologist to analyze with a microscope or to an outside laboratory to run specialized tests on the tissue. The major benefit of a biopsy is that this information can be used by your doctor to formulate a cancer treatment plan that is tailored to the specific type of tumor that you have. It can even help identify specific mutations within cancer cells that can make them more responsive to certain drugs. Some known or suspected cancers are relatively straightforward to biopsy. For example, skin lesions can be directly sampled by a dermatologist who can visualize the lesion itself on the surface of your body. Similarly, lesions in the large bowel or large intestine encountered by a gastroenterologist during a colonoscopy are directly seen by a video camera and can be readily sampled when identified. In contrast, suspicious lesions in other organs or in the soft tissues are often identified by imaging studies such as CT scans, MRIs, PET scans, ultrasounds, or mammograms. These lesions cannot be directly visualized and sampled without invasive surgery, which many patients like to avoid unless absolutely necessary. As a result, radiologists, who are the same doctors that interpret imaging studies, are often called upon to use these same imaging tools to sample the lesions they identify in a manner that is generally faster, safer, and less invasive than surgery. This method of sampling tissues is called image-guided biopsy. Most image-guided biopsies are performed with ultrasound or CT guidance. The exception is breast imaging, which sometimes uses other specialized biopsy techniques. When you arrive for your biopsy, a radiologist will first plan the approach to the biopsy by briefly re-imaging the area of concern. Once a safe path to the area of concern has been identified, the overlying skin will be cleaned and sterile drapes will be placed around the biopsy site to provide a larger germ-free area in which to work. The skin and the deeper tissues en route to the area to be sampled will then be numbed. A small incision is then made to allow for the biopsy needle to be inserted. Then, while watching in real time with either CT or ultrasound, the radiologist will slowly advance the needle toward the area of concern, avoiding other critical structures such as large blood vessels along the way. Once the target has been reached, it will typically be sampled several times, usually 2 to 3, and the tissue samples will be inspected for quality. The biopsy needle is then removed from the body, and typically only a small bandage is needed at the incision site. There are several risks associated with image-guided biopsies. First, whenever we break the skin, there is a very, very small risk of infection. This is why the procedures are done with sterile technique. There is also a risk of bleeding that varies according to the site being sampled. For most image-guided biopsies, the risk of a significant bleed is quite low. There is a risk of damage to surrounding organs in the body, though this risk is minimized by using image guidance, which allows these structures to be seen and avoided by the radiologist. In the case of a lung biopsy, there is a risk of a pneumothorax, meaning that air gets into the space around the lung. This air will usually resolve on its own, but may occasionally require placement of a chest tube to remove the air and re-expand the lung. There is a small risk of an allergic reaction to one of the agents used during the biopsy, such as the numbing agent or the cleaning agent used at the beginning of the procedure. Your radiologist should verify your allergy history before the biopsy begins. Finally, at centers that use conscious sedation to help patients relax during the procedure, there is a risk of an adverse reaction to the sedation medications used. You should tell your radiologist and your biopsy team if you've ever had any issues with sedation or anesthesia in the past. Nearly all image-guided biopsies, even the most complex, will generally take less than an hour to complete. And once setup has finished, many can be completed in only 5 to 10 minutes. These biopsies are generally very safe and well tolerated. As a result, these image-guided biopsies are generally much preferred by patients over more invasive surgical approaches and can meaningfully contribute to your cancer care and management.